Are you unknowingly taking medications that could silently wreak havoc on your health? It sounds shocking, but the truth is many of the medications that millions of people rely on daily, some of which may even be sitting in your medicine cabinet right now, could be doing far more harm than good. Even more surprising is that the very doctors who prescribe these medications often steer clear of them for their own personal use. Why? Because they know the hidden dangers, the long-term risks, and the potential for severe, irreversible damage that you might not be aware of. Imagine taking a simple pill for a headache or heartburn, believing it's harmless, only to discover years later that it has caused permanent damage to your organs, or worse, increased your risk of life-threatening conditions. Here's the question you need to ask yourself. Could this be happening to you right now? Think about it. How often do you take medications without a second thought? Maybe you're trusting the prescription, the label, or the fact that it's over the counter, assuming it's perfectly safe. But what if I told you that the very same drugs you take regularly are ones that doctors would never dream of taking themselves? This isn't just a case of overuse or misuse. These are common medications prescribed every day, yet they come with consequences that are rarely discussed. The real danger lies in what you don't know. You may feel fine today, but some of the medications you rely on could be slowly deteriorating your health, causing silent damage that you won't even notice until it's too late. Think about that for a moment. What if the very medications you've trusted for years are setting you up for serious health problems that could have been avoided? You might have already experienced side effects like fatigue, muscle pain, or digestive issues and brushed them off as minor inconveniences, but those could be warning signs of much bigger problems. By the time these issues escalate, reversing the damage might no longer be an option. Can you afford to wait until it's too late to find out? But here's the thing, this isn't just about scaring you. This is about empowering you with life-changing knowledge that doctors already have, but many patients don't. Over the next few minutes, I'm going to reveal 5 specific medications that doctors avoid for themselves and their families, medications that could be causing more harm than good in your life right now. If you're taking any of these medications, you're going to want to watch closely, because this information could make all the difference between living a healthy life and unknowingly setting yourself up for serious health issues down the road. Now you might be thinking, I've been taking these medications for years, how bad could they really be? That's exactly what many people think before they find themselves dealing with chronic conditions that could have been avoided. These aren't obscure, rare medications. They're the ones you're prescribed regularly, the ones you might assume are totally safe because they're so common. And that's what makes them even more dangerous. The widespread use of these drugs has led to a false sense of security, but behind the scenes, the risks are real. I want to make something very clear. This isn't about scaring you into throwing away all your medications. It's about making informed choices and understanding the hidden dangers that often go unspoken. You deserve to know the truth about what you're putting into your body and how it could affect you in the long run. By the end of this video, you'll have a clearer understanding of which medications you should think twice about, and why doctors, who know the science better than anyone, often refuse to take these drugs themselves. You'll also learn what alternatives you can consider, because there are always safer options available. But you won't want to miss a second of this video, because some of the most critical information will come towards the end, including one medication that most people take daily without realizing the shocking long-term effects. Stay with me until the end, because this could be the key to safeguarding your health in ways you've never even considered. Remember, this isn't about creating panic, it's about giving you the tools to make informed decisions about your health. By the end of this video, you'll be better prepared to talk to your doctor about your medications, and you'll know what steps to take next. This could be the information that changes the course of your health for the better. So, let's get started on revealing the 5 medications that doctors avoid and why you should too. Let's dive into the first medication, painkillers, specifically non-steroidal anti-inflammatory drugs or NSAIDs. They're among the most commonly used medications worldwide. When you have a headache, you take an ibuprofen, or when you have muscle pain, you pop a pill. It sounds harmless, right? Wrong. NSAIDs, such as ibuprofen and naproxen, are linked to a host of serious side effects. Studies have shown that long-term or frequent use of these drugs can lead to gastrointestinal bleeding, ulcers, and even kidney damage. What's even scarier is that most people don't realize this damage is happening until it's too late. The discomfort that NSAIDs mask in the short term could be leading to far worse problems down the line. You might even think you're avoiding danger, by not exceeding the recommended dose. But here's the kicker. Even at normal doses, NSAIDs can cause these life-altering side effects. Doctors are aware of these risks, which is why they often avoid NSAIDs themselves unless absolutely necessary. They know that the risks outweigh the benefits in many cases, yet millions of people take these drugs daily without a second thought. Could this be happening to you? Stick around because the next medication might be even more shocking. Next up, statins. Statins are a class of drugs used to lower cholesterol. They're prescribed to millions of people around the world to prevent heart disease. But here's the thing. Statins come with a slew of side effects that can seriously impact your quality of life. Muscle pain, fatigue, and even memory loss are just a few of the documented side effects. Now you might think, I need these to manage my cholesterol, right? But the truth is, many doctors don't take statins themselves unless there's no alternative. Some experts believe that the widespread use of statins may be overblown, driven more by pharmaceutical companies than by real medical need. The next time you're told to start on statins, take a moment to ask yourself if it's really the best option for you. There may be other, safer ways to manage your cholesterol that don't involve taking these controversial drugs. But wait, before you make any decisions, there's another medication on this list that you need to know about. Proton pump inhibitors, or PPIs, are the go-to treatment for acid reflux and heartburn. They work by reducing the amount of acid your stomach produces, giving you relief from those unpleasant symptoms. But here's the dirty little secret: prolonged use of PPIs can lead to some serious health issues, including kidney disease, bone fractures, and even an increased risk of stomach cancer. Yes, you heard that right. What seems like a harmless pill to stop heartburn could be setting you up for some major health complications. What's even more troubling is that PPIs are often prescribed without a clear end date, meaning patients can end up taking them for years without realizing the long-term risks. And here's a fact that might shock you. Many doctors are very cautious when it comes to prescribing PPIs for themselves because they know the risks all too well. So, why aren't patients warned? It's a combination of lack of awareness and the misconception that long-term use is safe. If you're taking a PPI, it's worth talking to your doctor about the risks and exploring other options for managing acid reflux that don't come with these hidden dangers. So, what's the takeaway here? The medications you take without a second thought might not be as safe as they seem. Painkillers, statins, PPIs, antidepressants, and sleeping pills all have serious risks that most people aren't fully aware of. Doctors know this, which is why many of them avoid these drugs whenever possible. But now you're in the know, and you can make more informed decisions about your health. Remember, there are always safer ways to manage pain, cholesterol, heartburn, mental health, and sleep that don't come with the same risks. Don't be afraid to ask your doctor about other options and do your own research. If you found this information helpful, feel free to share it with your friends and family so they can benefit from it too.